Assalamu alaikum. Hello, everyone. How are you? I hope everyone's well today. My name is Zainab, and I will be filling in for Saad today. Saad sends her love and wishes she could be here with us today. She is a proud mama this weekend. Her son just graduated from the U.S. Marines, so we're very excited about that. Yes, and I know I cannot fill her shoes as host today, but I hope to at least come close. So we want to thank everyone for being here today on this lovely but windy day. You could be anywhere today at this hour, but you chose to be here with us and share this space and time, and we really appreciate it and are blessed to have you here with us. Welcome to Mom's Corner. Mom's Corner is one of many programs under the umbrella of Global Perinatal Services. And as many of you know, Global Perinatal Services is a nonprofit. Our mission is to provide community-based doula services that will educate, respect, and empower low-income refugee and immigrant women and their families during pregnancy, birth, and into early parenting. Mom's Corner is a space, is not just a space for moms, but for all women folk. And since the pandemic, it has become not just as a space where we come to find empathy, support, and camaraderie, but a safe haven, if you will, and access to so many critical services in our communities. Today's topic is female infertility, and we want to acknowledge the sensitivity of the topic and express our compassion for those suffering from infertility and all of its complexities. We will have Q&A after the presentation, but if you should have any questions or concerns during the presentation, please feel free to put them in the chat box or send it to me privately, and I will pass it on. And so I want to a great thank you to our doctor for coming today. And without further ado, the floor is yours, Dr. And thank you for coming.
It's always a pleasure. So this, like you mentioned before, is a very sensitive topic, but I think a very important one to talk about, knowing that just affects many more people than you would expect. I wanted to make sure that we had plenty of time for question and answers based on our prior sessions. We actually spend most of our time chatting and just talking about each other's experiences and being able to answer questions. So my presentation is a little bit shorter than normal because I just so you guys are aware, I do have to leave around no later than like 6:15. So I wanted to make sure we had enough time for questions and answers. So with that said, I'm gonna, oh, would you be able to unshare your screen and then I will, wait, will this work? Oh, okay, I think I can actually do it. Okay. All right. Okay. So today we are going to be talking about infertility, specifically female infertility. We're just going to be going over the definition, what are some risk factors, what can you expect from your doctor's office and how we would manage it, and then just some resources. And then we'll have a question and answer session. So the technical definition for somebody that would be able to get the diagnosis of infertility is not being able to achieve pregnancy within 12 months of unprotected intercourse or therapeutic donor insemination. And I'll go over that insemination part a little bit longer, but basically 12 months of unprotected sex in women younger than or older than 35. And then if you're 35 and younger, it should be within, in women younger than 35, and then 6 months within women that are older. So the reason why there is a cutoff is because in women who are over the age of 35, if you don't get pregnant within this first 6 months, there's more of a time sensitivity. We want to make sure that you're able to get the workup sooner than you would otherwise, to kind of decrease your risk of having complications with your pregnancy and your delivery. And I think kind of one of the important things I wanted to point out here is I have a lot of patients and they've been trying for for 6 months and they're less than 35 and they're worried that like, is something wrong with me? Why am I not pregnant yet? And it is very normal to take up to 12 months for people under the age of 35. So I did want to make sure I put that as definition so you had that reassurance. And so some risk factors that I wanted to go over with, and we talked a little bit already during another Mom's Corner about preconception counseling, kind of how to optimize or get your body ready for pregnancy. And so kind of along that same line of what are the risk factors for infertility? What are the things that put you at a higher chance of being infertile or not being able to get pregnant in the time frame that we think you would get pregnant. So these are kind of the top 6. Irregular periods, and some people could have irregular periods because of some medications, because of life stressors, history of past cancers, smoking, tobacco, drinking alcohol, history of any sexually transmitted infections. Being over the age of 35 is a risk factor as well, and obesity. And so generally for women, the test will focus on looking at your ovaries, and so your eggs, how they're functioning, the supply, and then if there are any abnormalities of your sexual organs. Sometimes this can mean blood work, and other times it means doing different imaging like ultrasounds. And so we're looking to see if there are any obvious issues with your fallopian tubes, if there's something else going on in your pelvis that isn't allowing for you to become pregnant, and then also looking at your supply of ovaries. I did want to include the workup for men as well, because actually infertility is up to 40 to 50% of the issue in couples. And so it is not always, as a woman, our fault. 40 to 50% is actually an issue with the sperm. And so given the high prevalence or the high number of issues coming from the male side of the equation, we also try to make sure that we address that when we are doing a workup for infertility. And I do want to be honest, the reality is they're up to like a third of couples who we do all the workup, they get all the medications, that we do all the things, and we still don't know why they can't get pregnant within the expected amount of time. And this actually affects up to 15% of couples, which is a pretty high number when you think about it. So about 1 in 8 couples who are experiencing infertility might not ever know why they aren't able to get pregnant. And so a lot of the management is very specific to what is going on. There are a bunch of blood tests that we initially use to see, oh, is it because your ovaries or your eggs are getting older? Is there an issue with how often you're ovulating? Have we optimized everything? Have people stopped smoking? Do they have their chronic diseases like their diabetes under control? Is their blood pressure under control? Have we addressed their other parts of their health that can affect their fertility? Some people, they don't have regular periods. So once we give them medication, there are medications to help people have regular periods so that you can plan sex or intercourse with when you are ovulating in order to help you get pregnant. So there are multiple different strategies. I won't get into the specifics. I'll wait for the question and answer so we could talk a little bit more about that. The management in general, mostly medications, and then there are some surgeries. And at the end of the day, if everything looks normal and we still don't know what is going on, and you've tried the medications, we've done a bunch of imaging and ultrasound, so make sure everything looks good. There are 2 kind of specific procedures that are like most common that people pursue when they aren't able to have children naturally or get pregnant naturally, and that's intrauterine insemination. That's called IUI, and in vitro fertilization. So I just wanted to show you guys a quick picture, if you will. So in vitro fertilization, the main difference between these 2 things is where is the egg fertilized. So basically in vitro fertilization, you are actually taking the egg from the woman and then the sperm from the man and filtering it and making it go through a process to prepare it. And then you put um, the egg and then the semen together until they fertilize. And once you have a fertilized egg, you then use a tool to put it into the uterus. So in vitro fertilization, basically fertilization just happens outside of the body and then you put it in. Whereas with intrauterine insemination, all we're doing is we're taking sperm and putting it inside the woman's body. And so you could do this in the office. I actually know people who, for whatever reason, this didn't work, but they used like a turkey baster, like what you use to put stuff in a turkey or any kind of meat, and they use that instead. And this is something that different couples, for whatever reason, if it's a woman, for instance, that want to have children together, this is a method that some people have used as well. And so the fertilization happens inside the body, even though the semen is separate. And so here in the Pacific Northwest, most specifically in Seattle and the Seattle area, King County area, or just really the overall in this western part of the state, Pacific Northwest Fertility is an excellent resource, and where most people who have problems with fertility end up being referred to. They're really, really wonderful. They have resources online. And then the Mass General on the East Coast also has some really great handouts online as well. So I wanted to keep this presentation really short because I wanted to be able to go over specific questions that people had. So I'm just going to stop sharing the screen now, and let's talk a little bit more about infertility and kind of questions and things. I feel like there are lots of misinformation out there or lots of cool resources that people may have stumbled upon that maybe they can share. But yeah, I feel like I know I've heard a lot of different things about positions for intercourse that help you get pregnant earlier, foods that you're supposed to eat. And to be honest, a lot of that data that we don't have a lot of evidence for those specific things. And so usually position of intercourse does not matter as much. I think acknowledging that 40 to 50% of the time it's actually a problem with the male part of the equation. So acknowledging that, and that knowing the technology that has been developed over the last several years is actually quite elegant and is very successful. There are a lot of people who have healthy babies after intrauterine insemination or IVF. And a lot of the time, like after you've gone through this process, I've had patients who have had all of these services covered by their insurance. So those are some of the main things that I hear people ask or have questions about. I'm gonna take yes. Oh, Seattle Fertility. I have not used. I usually go to Seattle, Pacific Northwest. Thank you for sharing that.
Yeah, I've had people who went through that and had some success. This place, Kim, you said insurance cover because one one of the things that people always complain about is that it's not covered through insurance, or like if it is, it's so expensive that the out-of-pocket pay is so much. Do you know anything about that?
With Medicaid, it has varied a lot. I think so. The initial workup is not often covered through the Pacific Northwest Fertility Clinic. They do have like a cheaper out-of-pocket sliding scale that is more affordable, I heard, than some other places. So that's why I end up sending most of my patients there, because most of my patients are either self-pay or they have Medicaid. What I have seen, I've had some people have luck with insurance for the like IVF, but the workup up until the IVF has not been covered, like initially, like the sperm analysis. If there is a medical condition associated with the imaging, it can get covered by insurance. But for like semen analysis, that doesn't get covered. But if somebody's having irregular periods or you can use that to help insurance cover the imaging and some blood work. So it's more so what is your, like, making sure that you share your concern with your doctor about this, about the finance of it. They can get it covered by insurance as long as it's associated with another medical condition instead of just, oh, trying to get pregnant kind of thing. I'm not sure if that quite makes sense. I think for the semen analysis, the cheapest I've seen it is $200.
That's usually the first line of like recommendation of that you recommend folks to do, like one of the first.
I do a two-part. I look at the female and then I look at the male. So for the female, and it depends on how much money and how many resources you have. So some couples say it's usually actually a little bit cheaper to not do the semen analysis initially. So let's say you're younger than 35 and you've only been trying for 6 months, but you're really nervous and you want to see what else is going on. I would usually start with the female first about what kind of blood work we could do just to make sure everything looks okay before I go down the route of sending the male for the semen analysis, because like I said, that's usually out of pocket, and it's usually, I think one patient told me she was able to get it for $75, but I don't know where she ended up going, and she never followed up with me afterwards. But let's say finances isn't a problem, you're over 12 months, or like you're 35 and you've tried for 6 months, then I would send both people, like, okay, so I would send the woman to get blood work and then I would send the man to get the semen analysis. So sometimes, and it's about 50-50. So it really depends on what the family is willing to do and what they're willing to spend their time and resources doing.
So doctor, did you say Medicare, Medicaid covers some of this, or they don't?
Medicaid does sometimes. It depends on what you how you bill it. Yeah.
Okay.
But I've had luck with my patients because most of my patients are Medicaid.
About what percentage do they pay?
Oh, it all varies because they have different programs too within Medicaid.
Yeah, absolutely. The IUI, is it more like trying to get the sperm to reach the egg? Is that the situation with that one? I know with, like you said, if partners, like same-sex partners, that's something they can use, but is that more what it's for, the UIU?
Yeah, exactly. For like same-sex partners, let's say they get a donor, but they and there's nothing wrong with the sperm, but they don't want to have sex with a man. You can, that's when they can use like a turkey baster, and then the semen will just go up on its own.
Okay.
And then I have a question: is there any evidence on genetics having anything to do with infertility, or is each person different? So genetics plays a huge role, for sure. The evidence for it and what specific genes vary. So for instance, if you're a person who, let's say your mom had a really hard time getting pregnant, and then you find out that she actually has PCOS, or polycystic ovarian syndrome, that can be genetic, and that can affect your ability to get pregnant. And so it's mostly the genetics associated with specific medical conditions. But yes, each person is different. And so there are families who only one person has a hard time getting pregnant, or everybody is very fertile. So it very much depends. I think another thing that we're learning more and more too is stress has a huge impact on your overall health and your hormone levels. And so making sure that your body is also not stressed. One thing that I counsel my couples on specifically too, before they even get like blood work, for instance, for the male side of it, so tobacco use actually lowers sperm count. So if your partner is smoking and you're trying to get pregnant, that's actually one of the things that could help you guys get pregnant faster, is actually him not smoking. And so that's something to consider. Smoking has also been connected to like erectile dysfunction. And so that can obviously affect intercourse. Women who are smoking as well, it could actually speed up the aging of your eggs. And so introducing those toxins into your body from smoking can make you have a harder time getting pregnant because your eggs are just not as healthy as well.
Can you talk a little bit about like the tests that the guys have to do aside from the sperm analysis? Like what other tests can they use?
Yeah, and so actually the test for the men is a little bit more simple than the women. So just to say what we're doing for women first, so we look at your eggs, like how, like for instance, how many, and then we look at the quality of the eggs, how old are they? Then we have to look at your fallopian tubes. So is there any scarring from any old infections, or is your body just made in a way that it's actually hard for the eggs to go through the tubes? And then we look at your uterus and see, are there any issues inside your uterus that's making it hard for the egg to implant? And so for women, we do a bunch of blood tests, imaging tests. For men, the biggest thing is their semen. So we look at their semen, we look at the count of the semen. So when they ejaculate, how much sperm is actually in the semen. Then we look at the semen itself, because the semen, it's almost like a tadpole, right? And so we look at the tail of the tadpole, like are they able to swim appropriately? And so mostly it's a semen analysis, and that's usually about it. We can also do some anatomy scans and see, is there supposed to be more semen? What's going on? If like other things too that can affect the quality of the semen is if your partner only has like one testicle, for instance. So some people, when they're younger, have had like infections, or their testicles didn't come down all the way. And so having increased heat by the testicles could actually make men less fertile, because they aren't able to produce as much semen, or the semen is not as viable, I guess. It's not as like alive because of all that extra heat exposure. So that's what it would kind of look like. We would basically just send their semen to a lab, and then the lab does all the testing. So they don't have to go back and forth a bunch of times like women might need to.
Thank you. Any questions, guys?
I think Taylor has a question. Zay, she chatted.
Yeah, that was answered, I believe.
Yeah.
Oh, okay.
Yes.
And I could talk a little bit more about the risk factors as well. So we talked about age being older than 35. And so for both women and men, as your age increases, you do have a lower chance, and it continues to grow as you get older. And so specifically, like a 30-year-old woman basically has like a 20% chance of getting pregnant in any month. Like even without trying, you have like a 20% chance in your 30s. And then as you get older, even like from 30 years old to 40, the chance of getting pregnant every month goes from 20% and it drops down to 5%. So that's why for women over the age of 35, after they try for 6 months and they don't get pregnant, that's why we kind of try to make that work up faster. The other thing about women over the age of 35, they are also more likely to have a miscarriage, or to have a child with a congenital condition. And part of that is that you are actually born with your supply of eggs is what you're born with. So your body actually makes those eggs while you're inside your mom's womb before you're even born. And so through all those years of living, your body is slowly having little mutations and you're aging, and so that the eggs just have more um, life has impacted them more, and they carry those mutations and those possible conditions, and so that's why it is also like harder to carry a pregnancy to full term, because the quality of your eggs just aren't as good. With that said, I've had patients who have kids in their 40s who are doing just fine. They're beautiful, they're healthy, there's nothing wrong with them. So I don't want to scare anybody about that, but I just want to let you know that that is why we have concerns and want to make sure that we help support people in every way, especially if you're over the age of 35.
So with that, doctor, like you said, the quality of the eggs go down over the years. So if you freeze your eggs and you get pregnant, then the quality won't be like, it won't diminish, right? Because you've been freezing your eggs.
Correct. Yeah, and the technology for egg freezing, by the way, has increased in quality significantly. So even like 5 to 10 years ago, the technology that we're using now is much more refined. And now some insurances and some jobs are paying for it because they want their female employees to be working longer, not having to worry about like, oh, my eggs are getting old. And so if you chose to get your eggs frozen, the process that you would be then getting pregnant by would either be IUI, so intrauterine insemination, which I showed earlier, or in vitro fertilization, because at that point you have already taken your egg out of your body. And one of the interesting things about IUI, or not so much IUI, but in vitro fertilization more so, is there's a higher rate of twin and triplet and basically multiple pregnancies, because with in vitro fertilization, they've already taken those fertilized eggs, but we don't know if it's going to stick, like literally stick in your uterus. And so they try to put more than one fertilized egg in hopes that at least one of them will stick. But sometimes more than one sticks, and sometimes 3 stick or 4 stick. And so that is something to consider and be aware of.
Wow.
Folks are quiet today.
Yeah.
And
Doctor,
it's fine.
so sorry. Okay.
No, go ahead, Z.
I was just wondering, is there like signs that one, like, is there a sign that someone's infertile even way before they start like trying to conceive?
Yeah, that's an excellent question. And if I'm being honest with you, I actually hate the word infertile.
Mhm.
I feel like it, because I feel like it's not really reflective of what's actually going on. It's not that there are some people who can't get pregnant.
Yeah.
And with even with all the interventions, for whatever reason, their body won't allow it to happen, or like their eggs just are not compatible with life. And so those people I feel like are infertile. But I feel like in general, it's like people who have problems with pregnancy, or like women pregnancy problems, or I feel like conception issues would be like more accurate. Oh my goodness, I just forgot your original question. What is your original question? It's been a long week.
What was I asking? Oh yeah, the signs, like that you can't.
Oh yes, the signs. And so one thing that we tell people, so it was interesting because when I was doing this talk, I was like, it's hard to talk about infertility without talking about fertility. And so when people talk about preconception counseling, we talk about how to see if you are like in a good place to start trying to get pregnant. One of the things we tell people to do when they are trying to get pregnancy is having intercourse at the right time. And so we tell people, one thing that we look for that can be a sign that you are ovulating normally is you have a regular period. And so if you're a person that has never had regular periods, that can be an indication that it might be difficult for you to get pregnant, because you can't plan you have to plan in order to increase your chances of having like more than just a 20% of just getting pregnant with intercourse. You want to time it when your egg is being released.
Mm.
And so that partially has to do with people use their period as like an indication. Okay, I ovulate. You usually ovulate like about 7 to 10 days after the start of your period. And so when you're trying to get pregnant, you'll notice that when you're ovulating, you'll have a different discharge. And part of the reason why you have that discharge is that you're trying to make a better environment for the sperm so the sperm can survive. And so that's one thing that people could like look for. It's like, oh, I've never had regular periods, or oh, I can never tell when I'm ovulating. And there are kits and calendars that people can use to kind of figure out what their system is. I think another thing that people can consider is addressing their risk factors. And so we talked about smoking, and alcohol can also decrease your risk. Similar reasons to the tobacco, mostly affecting men, but can also affect women as well. Obesity is another risk factor, and part of that is just the extra fat tissue you have on your body actually affects the different hormone levels throughout your whole body, and so that's one of the reasons why that could be a risk factor. Age, so if you're over the age of 35, just know that it could just be harder to get pregnant. There aren't any super obvious signs. I think people who have polycystic ovarian syndrome and people who have that condition often have irregular periods or abnormal hair growth. Like they might have more like upper lip hair or more like chin hair, or like male patterned hair can be a hint that you might have this condition. They might have like darker skin in their like armpits or their on their neck, and that can be a sign of what we call insulin resistance. And so diabetes can be a risk factor for infertility, like poorly controlled diabetes. And so looking for some of those things and your overall health can give you a clue of, oh, I have risk factors for not being able to get pregnant easily.
Thank you.
I have
Looks
a
like
question. How about diet? Does diet, certain foods play role of increasing the chances to become pregnant?
That is a really good question. So I was trying to look before I gave this talk because I have heard about so many supplements and pro-fertility diets. I was looking for the ones that had any like strong evidence behind it, and I honestly couldn't find any good enough that I would be like, you should spend your money and your time on this. A lot of it was anecdotal, people saying like, oh, I tried like a gluten-free diet, or I tried like a vegetarian or a vegan diet, but there wasn't so much data behind it. What I will tell you is some of the information, so like DHEA, so that's a kind of healthy fat, which is actually something we recommend for people to take in their prenatal vitamin. That is a particular nutrients that it's rich in small fish, for instance, that we recommend people make sure they have enough of during their pregnancy. And so honestly, just taking your prenatal vitamin will probably cover you enough. Like in the preconception counseling, really just optimizing your diet, like with fruits, vegetables, more vegetables than the fruit. Whole grains, not just like white processed flour foods. We're learning more that some foods have like an inflammatory effect on people's diets, and so that's something that we tell people to be aware of. There are, yeah, I wish I could just like give people like a list of like these are the foods that will help. For instance, like I've heard like cranberry and like pomegranate, for instance. I I can't think of why specifically those, but they've been marketed as things that could help with fertility, but I don't know specifically why. So I guess the short answer is really just eating a healthy diet while you're trying to get pregnant is the key, and avoiding like alcohol and tobacco.
No chips and donuts. Mhm.
No chips and donuts. In general, the foods that you definitely should avoid are like fried foods, or like we call them like refined carbohydrates. So basically any white carb is not going to be good for you. So like whole wheats are much better. Sugar is not good for your body or your brain. Like red meat, or like processed meats usually aren't as good. So those are the things that you can avoid. Those are usually more like inflammatory foods too. But I haven't found foods that are like pro fertility.
Any other questions?
Yeah, just to touch on earlier, you talked about intercourse during around ovulation to have intercourse. Is it to increase intercourse around that time, or is it just for some people they or doctors advise to increase intercourse during around that time? So is that something that is helpful
Yeah,
for
definitely.
moms
And
or people who are trying to get pregnant?
yeah, and so we'll tell people, so most people use like a kit or a calendar to see when they're going to be ovulating. And so for most kits and most calendars, they'll actually tell you to ovulate, to have intercourse every like 1 to 2 days around the time of ovulation. And so usually you will like the man will have like a higher semen count if they're not like, so let's say you're going to be ovulating on Wednesday. You probably shouldn't have sex on Sunday then, because it's a little too far from Wednesday. And you want to make sure that the man has enough sperm count in the semen. And so having sex once a day, like maybe on like Tuesday, Wednesday, and Thursday, for instance, to right around the period of ovulation. Everybody kind of has a different style, but that's what I usually kind of counsel my patients on, is trying to have sex every 1 to 2 days around the time of ovulation that's expected. And it's mostly like the timing and the frequency. So I don't think people need to have sex twice a day, like on the day of ovulation, but it kind of all around that time period is important.
Yeah, so just to follow up on that, if a sperm count is low, is there anything that male can do to increase the count and for their for the sperm?
Yeah, and so if it depends on what the cause is. If, for instance, if there are medications that men can take as well. So some of them cross over and actually are similar to the medications that women take. Aside from medication, other things like if they're drinking alcohol or smoking tobacco, those are two things that we tell people that they should really quit. And so that can also help improve sperm count. Usually the sperm count is lower for either from like age or some other external thing, like something like bad that they're doing to their body, for instance, or let's say they wear really tight underwear, for instance. Like we don't really have any strong evidence for people who wear like boxer briefs or boxers And even just like the regular, like whitey tidy style is fine, but making sure it's not too tight is important. Cool.
I think we should let Dr. Kimberly go, yeah?
Mhm.
So yeah, since no one else has any questions, but beautiful questions that came through.
Yeah.
Yeah, and we'll post this up on our brand new YouTube again. I'm really proud of that channel, as you can tell. And yeah, and people can refer to this as well.
Mhm.
Awesome. Yeah. And please tell me what you guys would like to talk about for the next one next month. But we're happy to redo topics as well. I know as like the weather gets nicer, since the water, like people are going to want to be outdoors and whatnot. So we're happy to be flexible, and I'm glad you guys have a YouTube channel up.
That's right. That's right. Yeah. Yeah. We'll definitely circle back to you all about what the topic, because there is also a WhatsApp group that we have where most of the discussions take place, and we'll put it out to people what topics they want to hear, and then we'll circle back to you and the other doctors, Kimberly.
All right. Sounds good. Hope you guys have a good evening. See you next month.
Doctor.
Awesome. Thank you so much.
Bye.
Yeah.
Bye. Thank you, everyone,
guys.
for coming today.
Thank you so much
Mhm.
for hosting,
Oh, sure, yeah.
filling in
I
for
know.
Saad. Yes.
Minister Adia.
Yeah.
Mhm. Awesome.
That was cool. Saad's somewhere on what is it? At the beach, enjoying the sunshine.